Today's video is about two things that you can do to help diabetic kidney disease. Really important tips. Okay, so we're going to talk about the research, what it means. If you're new to our channel, subscribe. If you've been here before, welcome back. So let's get into that research. If you got diabetic kidney disease, here's some things you should do. So we have the observational study journal. It's an observational study in the Endocrinology Journal, May 2022, impact of salt intake on urinary albumin excretion, so proteinuria, protein in the urine, in patients with type 2 diabetic nephropathy, a retrospective cohort study based on a generalized additive model. So you can look that up. What does it say? Salt sodium. Okay, for most people, they know that this is generally bad for kidney disease. If you don't know, then it's really important that you look to reduce your salt sodium intake. I found that people that reduce their salt and sodium intake, especially in stages 2-3, diabetic nephropathy, were able to lower their proteinuria. We've known this for a long time, okay? This should be a standard recommendation for anybody with kidney disease, how important it is to get sodium out of your diet, salt. So you don't want to use the salt shaker, okay? You want to look for foods that are lower in sodium. So fresh foods, fresh fruits and vegetables are going to be lower in sodium. Fresh animal products, if you're eating animal products, will be lower in sodium. Next, if you're getting frozen, okay, or canned foods, okay, canned fruits and vegetables, whatever you may be having, look at the nutrition facts to make sure it's low in sodium, because most things on the shelves are going to be high in sodium. So look for lower sodium option. Sometimes it's put right on the front label. But I want to just talk to you about, this is so important because it lowers protein in the urine. And that's one of the things that is the most damaging to the kidney over time. That's why they're always trying to give medications to stop it. By adopting certain diets, changing your diet, you can improve it. So you want to get that salt down. Now, you're going to have to know how to read a nutrition facts label, which is on the back of most foods that you buy, which will list the sodium there. We're going to do a separate video about that, but that's something that you really need to be mindful of, is looking at the nutrition facts label, turning over or finding it on whatever food, packaged food that you're having, and it'll tell you how much sodium has been added to it. So make sure you do that. Now the levels, if you're looking for guidelines, ideally 1,500 milligrams or less, which is really hard to maintain. 2,000 milligrams or less is more realistic, but for diabetic kidney disease, no more than 2,300 milligrams per day of sodium, and you should strive for the lower amounts because more good things happen when you have lower amounts. So make sure you do that. Really important for the protein that's in your urine. You can lower it just by doing that. So what else we got for diabetic kidney disease today? We have the Journal of Diabetes Research, May 2022, association between vitamin D status and mortality among adults with diabetic kidney disease. So if you were deficient, okay, in vitamin D, or you were low normal, you unfortunately died quicker if you had diabetic kidney disease. So it talks about the importance of proper vitamin D supplementation. Okay, I have other videos that talk about that. But you should have your levels tested first of all, and they should be a little bit higher than the cutoff, which is 30 on most blood work. So if you're 32, 33, still not that great. You get more protective benefits if you get that level up to 40 to 60, so you probably need to supplement. You can try getting a lot of sun, but you would need that every single day for periods of time of at least 15, 20 minutes. But you still might not convert it with kidney disease, so supplementation is generally best. So make sure to get it tested. So diabetic kidney disease, do those two things to really improve your health, your situation. And with vitamin D, you get lots of other benefits besides that reduced risk of mortality. Check out all of our other videos. Thanks for watching, everybody, into your best kidney health.